The biggest bugaboo, the biggest fear of everybody with myasthenia gravis is a myasthenic crisis. And a lot of people don't understand what it is. Very easily explained. It's when the respiratory muscles get so weak that you can't move enough air in and out of the lungs. Okay? The person is completely unable to breathe enough, and so you wind up on a ventilator to help you breathe. It can either be through a tube down the throat, that's when the patient's intubated, or through a mask on the face, and that's BiPAP. Okay? So either one. Okay? All right. A lot of people think, oh, an MG flare is the same thing as a crisis. And we just had the big argument on Facebook a couple months ago. And they said, it's semantics. My crisis is whatever it wants to be, okay? However, you have to use the terminology correctly in order to communicate effectively with your providers. If I go to my neurologist and I say, oh, I've had 2 crises before, he says, oh, were you intubated? No, I was never short of breath. He's going to say, oh, this person has no idea what she's talking about, and I will have 0 credibility with my provider from that point on, okay? It is very, very important to use the correct medical terminology, and the terminology states that the official definition of a myasthenia crisis is difficulty breathing, okay? If you're having trouble walking, if you're having trouble swallowing, if you can't move your arms, if you're having worse double vision, you're having a flare or an exacerbation. If you can't breathe, you're courting a crisis, okay? So just remember, it's all about the breathing. Is the crisis, okay? Triggers. Everybody's triggers can be different, okay? For me, high doses of steroids will put me straight into full-on crisis, and that's how I wound up there, okay? However, other people with myasthenia gravis, you can get lots and lots of steroids, and they will start feeling much better. So the individual triggers are very personalized. It depends on what triggers your MG. Bruce here probably doesn't have to worry about getting pregnancy-induced crisis, okay? However, the moms in the group may tell you something completely different, okay? Pneumonia and fever are 2 classic ones, okay? Choking and having difficulty breathing due to inhaling all the fluids that you're drinking, those are really, really common ones. Also, medications such as antibiotics. Those are classic triggers, okay? Timing. Some people will have a crisis come on like, boom, okay? I'll be feeling fine in the morning, and by lunchtime, I can be having acute difficulty breathing. Other people, the descent is more gradual, okay? And it's when you have that gradual decline that you start realizing, uh-oh, I'm starting to have difficulty. This is when I need to call my neurologist. Do not wait till the last minute till you can't talk anymore, okay? So if you start having symptoms where your breathing starts getting worse, it's time to act on it right away. Do not wait until you have completely stopped breathing, okay? One of the most common things I find on Facebook and when I talk to people with MG is they can't tell, is it anxiety or is it my myasthenia? And the way myasthenia presents, it's really, really hard to tell sometimes, especially by healthcare providers. It's very, very easy to look at somebody in crisis who's having trouble breathing, the pulse ox is 99%, which is what we do, like, oh, she's just anxious, okay? No. And so these are a couple ways I'm going to give you some assessments that you can do at home so you can tell, is this anxiety or is this really my myasthenia that's getting worse, okay? Something that somebody with real anxiety isn't going to see, but somebody with myasthenia, it's called orthopnea. And it's because the diaphragm can't work when you're laying flat. So the person goes to lay down flat in the bed and finds, I can't breathe. They sit up or put the head of the bed up. It's like, oh, breathing much better now. That's called orthopnea. You don't see that when you're just having an anxiety attack, okay? Rapid shallow breathing. People who are very anxious don't take rapid shallow breaths, okay? They're going to take very deep breaths, okay? People with myasthenic problems, the respirations are very fast and very shallow because those muscles are just too weak to get too much air moving in and out of those lungs, okay? Interrupted speech is one of the classic signs of somebody who's courting a myasthenic crisis. and it's because I can't get enough air into my lungs to be able to complete a sentence. So I wind up speaking like this, okay? And when you start seeing somebody talking like that, that's a very clear indicator. There's some respiratory problems going on that need to be looked at, okay? A weak cough. If those muscles aren't strong enough to be able to give a good strong cough, the person's going to have a very hard time clearing mucus. So that's why pneumonia and bronchitis is very, very dangerous for somebody with myasthenia. Okay? If you're choking, it's hard to get the fluids that you've just inhaled into your windpipe out. Okay? So that weak cough. Okay? Sweating, even when the room is not too warm. Okay? It's because you're working so hard with every breath. It's like you're exercising. Okay? So if you're sweating and struggling to breathe and everybody else is feeling pretty cool, there's something wrong. Okay? This is one of the biggest problems, waking up frequently during the night, gasping for air. Okay? During the night, the respiratory muscles all relax so that when we're dreaming, we don't flip ourselves up out of the bed. Okay? That makes it difficult for us to keep enough oxygen and enough carbon dioxide in balance when we're sleeping. So sometimes the patient will wake up and just gasping for air. I do this if I have my head up my bed flat. Okay? So that is a very concerning sign. Okay? Feeling restless or drowsy. Okay? A lot of those signs indicate that too much carbon dioxide in the blood needs to get checked out. Okay? Normally when we take a deep breath, our chest wall expands with the breath. Okay? If the person is struggling really hard to breathe with a crisis, the chest wall actually shrinks in with each breath. That's very abnormal. People with anxiety do not do that. So if you see somebody doing that, that's a sign emergency help is really, really needed. Okay? And one of the big danger signs, if the person feels too tired to keep breathing, okay, chances are they are going to stop breathing. So we really, really need to get them into the ER. Okay? The single breath count test. This is one of the very best, very easiest tests that we can do. Take a big deep breath full of air and start counting out loud. 1, 2, 3, 4, 5. Okay, people with normal lung and respiratory function can get up to 50. Okay, and if you cannot get past 20 to 25, you need to start thinking about seeing the doctor. Okay. Anything less than 20 indicates significant respiratory muscle weakness. Less than 15, pretty much you should be in the ICU. It's a very good idea to have an idea where your baseline is. Okay? Mine usually runs about 35. When I start courting 25, I know I'm in trouble. Okay? Some people, their normal might be 50, so when they drop down to 30, that's when they're in big trouble. So know where your normal is, and so that you can tell when you're having difficulty. Okay? And the nice thing is you can do the single breath count test wherever you are. There's no medical devices needed. The pulse ox, you can get them on Amazon or Walgreens for about $20, and they're really, really handy. For most respiratory diseases like pneumonia, COPD, asthma, as the disease gets worse, the pulse ox value drops. And so we send people home with their pulse ox and say, keep a really good eye on that pulse ox and you let us know if it drops. Myasthenia gravis is the exception. We can have full-on respiratory failure and our pulse ox will still be a charming 99%, leading the doctors to think, oh, she's fine, when she could be in complete respiratory failure. So you can have a pulse ox at home, go for it, they're fun, okay, you can keep an eye on your pulse rate. And if it's greater than 95%, woohoo, but do not think that is the be-all, end-all, and because you have a great pulse ox, you're fine, okay? If it's less than 90, seek help, but just know that you can be in big trouble respiratory-wise, and that pulse ox can still be perfect. It's not a good indicator of respiratory function with people with MG, okay? There aren't a whole lot of people who can get their hands on real sensitive medical devices for MG. But in a pinch, you can use a peak flow. We use it for asthma. If you get one, it will help indicate to you that you are in big trouble. And it's based on body weight. You can blow into it. So if your numbers start to drop, you can tell the doctor, and he'll probably understand it because most doctors are familiar with asthma and these numbers. Okay? You can get them on Amazon for about $20 too. It's not specific to MG, but it will give you some clues as to when your breathing starts becoming impaired, okay? There's a little tool that hospitals use. It's called a nifometer, and it determines how much strength your muscles have to take a deep breath of air. Okay, that's called the negative inspiratory force. And some hospitals have a little disposable one that they use while you're in the hospital, and if you're a smart patient, you take it home with you. Okay. However, when I've wound up in the hospital, my hospitals do not use disposable ones. They have a huge one. It's like about this big, and then they put something huge on the end of it so the patient doesn't walk home with it, and the respiratory therapy doesn't lose it. So if you happen to have one of those nifometers, definitely use it to help keep an eye on your breathing status. But if you don't, you can use the peak flow, or easy peasy, no cost required, go for that single breath count. BiPAP. BiPAP is my little best buddy. It's my sleeping buddy, and I use it during the day when I get tired and short of breath. Okay, and it's a home machine. It's just like the CPAP, but it's the more fancier version, and it helps give me breathing support when I'm feeling short of breath. Okay, rather than having the tube down my throat, it's great. I put the mask on over my nose and mouth, and I can sit back, and it'll do a lot of the work of breathing for me, so I don't have to do quite so much work. Okay, you can get one of these with an MG diagnosis and a low score on your NIF test when you have that pulmonary function testing done. Okay, if you have one of these, you should make sure to take it with you to the hospital so that you can get hooked up on it right away. You don't have to wait for respiratory to come. Okay, we decided to do one PowerPoint with all of us. So after the next slide, Bruce is going to step up. But basically, we all agreed that you want to seek immediate medical help when you're having difficulty swallowing or difficulty breathing. Do not think, oh, it's just anxiety, okay? Seek help immediately as soon as you start noticing breathing difficulties, okay? Call the neurologist, okay? You want to go to the emergency room, okay? Call 911. And we're going to talk about next doing just that.
Okay, you may ask, why do you need an emergency plan for an emergency? You don't have to, by all means. You have choices. You can let the emergency EMS providers and ER staff do the care to you, or would you rather the care done for you, and you participate in that care? The other thing during an emergency, what happens is very likely all of us are going to get stressed. It's very anxiety. If you're not prepared for that emergency, what happens when you have stress? Stress is a trigger for your MG. It's going to exacerbate your MG. So you want to prevent that stress and stay as calm as possible. The other thing is when you have anxiety, what happens in the emergency room? The doctor's going to look at you and say, anxiety, I don't see anything else. This person's having an anxiety attack. So what we want to do is we want to be prepared. We want to be as calm as possible. That's almost impossible, but you do want to be in control of the situation. Okay, let's talk about a worst case scenario. You may not be the Dr. Henderson where you have your MG crisis doing a C-section. I know there's an ER nurse out here. She had her MG crisis in the emergency room. But for the rest of us, if we're at home, here's the worst case scenario. You're home alone, you have a crisis, you're able to call 911. Fortunately, your cell phone or your phone's by your side and you're able to whisper that you need an ambulance. You don't have any access to unlock the doors. Your dog is by your side, very aggressive dog, protective dog. So the ambulance arrives. They're not able to gain access to your house because it's locked. So they're going to have to call law enforcement. They're not going to break in the house. So there's a delay for law enforcement to arrive. They get there, they break in the house, and now they got to contend with this aggressive dog. They finally get the dog into another room, and they get to your side, and you can't give them any history. So they don't know anything to do but to take you, load you up, take you to the emergency room. Same thing. In the emergency room, they look up your medical records. No medical record. You don't have any medical information. You can't talk to them. You finally can tell them Your advocate is your spouse, and they leave a message because the spouse doesn't answer. But the ER doctor comes in, does an assessment, and determines he can't find anything. You're anxious, and he says, well, I guess we're having an anxiety attack. And they wait for your spouse to arrive. Well, your spouse finally gets the message, calls and says, they have MG, please contact the neurologist. And finally, your spouse gets there, the doctor comes in and says, oh, we're having an MG crisis, and you end up in intensive care for 10 days. What could have changed? Could we have done anything differently? Yes. One of the first things you can do is 911. You can contact your emergency 911 center and ask them if they have what they call computer-aided dispatch. A lot of times, they'll allow you to register your information in their CAD system. You tell them that you have myasthenia gravis. You give them a little bit more medical information. Let's say you live in a rural area. Your house is hard to find. You can give them directions how to locate your house. Now 911 centers, sometimes some of the new ones, you can text. Find out what new technology they have. Can you text a 911 emergency? Some of us may not can talk, but we can get on a little phone and text that 911 message. And then, of course, you have the medical alert systems that you can push the button, I'm falling, I can't get up. But contact your 911 center. Recently, I don't know if y'all heard, there were a lot of AT&T customers that have 911 outages. And the only way to contact them was through the non-emergency number. So when you call 911, you want to contact the non-emergency number. You don't want to call them on 911, and make a note of that non-emergency number just in case 911 goes down. Preparing for the first responders to arrive. Make sure your address is visible. You don't want that ambulance driving up and down the road trying to find your house. I can tell you many a days, many a nights, I could not find that house. Some people you can put, there's now smart locks, or you can buy one of these lock boxes like the realtors use. You can put your key in there. When you call 911 or you register with 911, give them that information, how they can get your key to get in your house. The other thing you can do with smart lights. I've got the Hue lights, and I just tell Alexa, I said, Alexa, trigger emergency lights. And then my front porch lights start blinking. I tell my neighbors, if you see my lights blinking, please to come. Emergency responders are going to see those blinking lights, and that's going to help identify your house. Notify your neighbors. Your neighbors can be a really strong advocate for you. They can come help get into your house. They can help secure your pets, and they can be your advocate. So learn your neighbors, educate your neighbors how to be an advocate for you if you have an emergency. Communications is key. You got to be able to communicate with the first responders and with the EMS, with the ER staff. We talked about medical alerts. These are very handy. I don't like wearing jewelry, so I use other options for medical alerts. But there's a number of these, and I'll go through some of those. You have some new ones that are called USB jewelry. And you have a little USB card that they can pull out, and they can plug into their electronics, their computers, and bring up all your medical history. QR jewelry. This is something new. That little bar scan, that's a QR, and you can wear this jewelry, and they can just scan that QR bar and bring up your medical alert information. How do you create a QR code? Here's the information. I use the QR code. I use the V card. It just gives a little basic information, but the most important thing is it gives a link to my iCloud Dropbox account. And if you go to my Dropbox for medical records, you have everything. If they want to know my last blood records, my last test, my last discharge from the hospital, everything's in my Dropbox. I have doctors ask all the time when you're in emergency room, what was this test? What were your lab results? What was this? You can't remember all that. So I just bring it up in my Dropbox, and it's right there. So these are the steps. This is in your material. You can create your own little QR code. Very, very handy. Medical alerts we talked about. This is the one where you have the I fall and I can't get up. You push that little button, and it will alert your medical contacts. It will have all your medical history in there. Some of them are even with your GPS, where if you're out and about, it's smart enough to know your location. So it's not only if you're at home, if you have that type of device. ICE. Everybody knows what ICE is in case of emergency. Very important, put that on your phone. All EMS services should know to check for ICE. There's an easy way of going about putting it on your phone, so if it's locked, they've made it simple to where the medical personnel can pull it up on your phone even if it's locked. Yellow dot, that's only in certain areas. It's something you can put on your car. Just check with your public safety to see if they have a yellow dot program, and if so, you can go to them and get the information and put this little symbol on your car. So if you ever have an accident or have an emergency in your car, they can look for your medical information. What I've done is I created my own medical alerts. The one on the left is what I have on the back of my phone. And then I have on my front of my phone, I have my screensaver, my medical alert, and my QR code. On my right, that's what I put on my dashboard. Instead of the yellow dot, I put that little medical alert with the note to look in the dashboard for my medical packet. Medical packet. This is the form, and you have that as an attachment. I put that on the front of an envelope or binder or whatever you have, but I put that on the front with all the information inside. But on the front, it's going to give kind of an overview of myasthenia gravis and the key points. You want those first responders to know that you have myasthenia gravis. What are you going to put in your packet? You're going to put all these informations, and I'm going to go through those. Medical history. Now, we heard earlier about the little cards, and those are great and highly recommend them. I like to keep things simple. My medical condition changes daily almost. My medications, I have a complex medical history with a number of medical illnesses. So I use a software program. It's easy for me to, well, my wife, she's always my advocate. She's always on me to make sure I'm updating that medical list and updating the changes with my health. And a software program is just easy to use because it's comprehensive and it's easy to update. This one I recommend because I've been using it for many years. They were nice enough to give us a discount for the conference, but you can go in, download it as a demo and try it out, see if you like it or not. But it's comprehensive. I mean, it's got everything under the sun you would want to keep as far as a medical history, and it allows you to print it in a format that is easy for you. Patients Like Me is another excellent resource. It is free. It's got an area strictly for MG patients, but you can use it as a tool also to record your medical information and print it. Again, I think the earlier group mentioned you do have a right to obtain your medical records. It's a federal law. They're now Most doctor's offices and hospitals have patient portals. The blue button, that's a government program, and it's an easy one to go to because that one you can go in and then find out all the different providers you use that may have electronic medical records. And especially those of us who have Medicare or VA, it's an excellent program to download your medical records from the VA or from Medicare. And it gives you the resource to go to those other patient portals. Microsoft Health Vault, it's another one that you can use for free. It tracks your medical information. When you record your medical documents, make sure you're recording all your complete medical history in all these other areas. Very, very important that you have this information. Medication list, you got to keep it up to date. Make sure you're putting down the dosages. Remember to record those other vitamins and over-the-counter medications, not just your prescribed medications. And of course, know your precautions. And definitely, an absolute, have your MG medication precaution list. I make the hospital put it on my chart. If I'm admitted to the hospital, I have it on my patient bed. If a nurse is giving me medication, I'm asking them, have you checked the precaution list? Emergency contacts, that's a given. Your physician contact. Health insurance, of course, you're not going to get in the door. Well, you'll get in the door, yes. But it's very important to have your health insurance. Advanced directive, also known as a living will. Have that document with you. Durable medical power of attorney, you got to have your advocate, whoever's going to speak on your behalf, you have to have that document. Advanced directives, here's some resources. Again, resources. And items to take to the hospital, the most important. My wife, I'll get her to stand up. I told her I was going to make her. She said, no. She's the best thing. I mean, I totally depended upon her when I go to the hospital. I remember when I had my crisis, doctors were out there in the hallway, and they're all talking about, well, what generated this crisis? She walks out there, and she says, have you considered methotrexate? He's got COPD, and methotrexate is cautionary, will cause shortness of breath. So they called the pulmonary doctor, and he said, yeah, she's right. So she knows what I'm taking. She knows the adverse reactions to it. She knows when to step up and speak on my behalf. You got to have your advocate. Take them to the hospital. When you're in a crisis, you can't talk. Take your medical devices and take your patient information packet. Okay, anybody that wants to catch me afterwards, there's a lot of stuff in here. And there's a lot of stuff you may want to add to the list for me. I want to keep this as current as possible. We're going to take questions at the very end. Okay, Sharon.
Okay, so the first question would be, if you do come into problems and you have to call 911, should you have a family member bring you to the emergency room, or should you ride in an ambulance? There's a lot of different things that you have to take in effect. Number one, are you going to go downhill? And could the ambulance EMTs offer support in between your home and the hospital? Number two is there going to be traffic? Will you be able to get there faster if you're in the ambulance? Another important thing to ask is, you always want to have an advocate with you if possible. I know that without my father, there's no way that I would have been able to communicate what was going on with me. My father has been my best advocate and is right there by my side majority of the times to be able to communicate that I have MG, that I have gone into crisis before, the medications that I am on, who my neurologist is. And it's very good if you can have your advocate ride in the ambulance with you. Sometimes they'll only let you go, the advocate, ride in the front. There has been times where they would let my dad or my sister ride in the back to offer assistance to them if they were having to bag me on the way to the hospital. Another thing is my current neurologist is an hour away from my home. So if I call 911 needing help and I'm in pretty bad shape needing respiratory support, the ambulance is going to bring me to the closest hospital. En route, you should have an advocate call your neurologist and let them know, hey, Shannon's on the way to St. Tammany Hospital, and there's a good chance that she's going to be intubated. Can you please call over there and give advance directions on what you want done? Typically, what will happen is they will bring you to the closest hospital. They will intubate you, stabilize you, get you to where you are stable, and then transport you to the hospital where your current provider is. A lot of times, I'm fortunate to where the two hospitals that I use, my neurologist is able to make calls at both. But there may be times where your neurologist is not on staff at that hospital, but they can call the ER staff and tell them what needs to be done or what they would prefer happen before they stabilize you and transport you to them. At the emergency room, if it is not a problem where you're in a full crisis, you're just in a bad flare. So we've talked about that, where a full crisis is you are unable to breathe on your own at all. You are needing support. A flare-up could be I can't move any of my limbs, but I'm still able to breathe. If you are just in a flare, they're not going to be as worried or as on the ball as if you were going into respiratory failure. But regardless, you still want your neuro to be contacted, even if he does not work out of that hospital. You want his orders to be what's going to happen to you, the one that's most familiar with your case, because all of us are different. All of us handle the different medications. All of us are different treatments. What works for one person is not going to work for the next.
When you get to the emergency room and the triage nurse says, well, what brings you here today? The patient who goes on a long, rambling story, and after I ate scrambled eggs this morning, and you know what's the best? Those egg beaters are just the bomb. And goes a long way around the barn. Okay, bad news. Okay, when you're meeting the triage nurse, when the ER doc comes in and says, "What's the problem? What's going on?" You want to be able to communicate with them very concisely. Make your point known, make it clear, so that they can get on to the business of getting you better. And when you can't breathe, okay, time is of the essence. One of the ways that healthcare providers do this when we communicate with each other is a tool called SBAR, okay? And it's like a template that we use in an order of giving information so that we can give information very quickly and easily. We know what's coming, and we get our point made, and we get what we want so we can go make stuff happen, okay? And that's a situation. So I'm concerned about, you know what? I came in because I'm feeling much more short of breath. Boom. Okay, and you want to use as few words as possible, okay? Background, okay? What happened that led up to this situation? I have myasthenia gravis, and it's been getting worse over the last few days. Boom, okay? Just very to the point. Assessment, I think the problem is, you know what, I started a new antibiotic, and it's aggravating my MG. I'm courting a crisis. Boom. And our recommendation, what needs to be done, call my neurologist now. I need BiPAP, and we need to start some IVIG, and I need some more prednisone. Okay? So it's just a tool to make sure that you communicate your needs very, very quickly. The nurses do this with the doctors, so they're used to this pattern of speaking, and you can also use it when you're communicating with healthcare professionals. And when you do it, they're going to take your credibility and your communication skills very highly, And then they're going to hold you in higher respect because of that. So it organizes information. Only the most relevant information is included, okay? And like I said, you guys can use this as well.
Another thing that I would like to add, there have been times where I was not able to speak at all, or I may have been intubated, and I needed to communicate with the doctors. And somehow I would get a hold of my cell phone, and I would motion to them just 1 second, and I would text and type out what it is that I needed to say. And at first, you know, I may have gotten some resistance, but you have to find a way that you're able to communicate, whether it's texting on your phone, getting it known that you need a pen and a paper to write down. Anything that you can to be able to communicate could mean saving your life. You have to be able to communicate with the doctors and let them know, you know, if someone's going to give you a medication, what medication is that you're giving me? I can tell you a personal story. I was ventilated. I was on a sedation break, so I was well aware of what was going on. The nurse came in and hung some IV magnesium, which is very contraindicated. And so I have my phone, and I'm texting, no, I can't have that. And the nurse told me, Shannon, we know what we're doing. Give me your phone. And I'm leaving my phone on my bed. And he went over to the IV and bumped up the sedation, and out I went, and in went magnesium. So I'm estimating maybe the next day my neurologist comes in and I'm texting to him, help, they gave me magnesium. And he's like, no, they wouldn't have done that. And sure enough, they did. So it leads me to something that my neuro has done, has listed magnesium and mycins and other antibiotics as an allergy in my chart, to where it'll come up an allergy and then it just says contraindicated, do not give. And that can possibly be a big factor. This is talking about the pulse ox and the ABGs. When the pulse ox starts to show that there's a problem, you are way into respiratory failure. Like we spoke about earlier, it can say 98, 99, all the way up until sometimes they're ventilating you. It is not an oxygenation problem. It is a problem within the muscles. So they need to rely more on the NIFs, which tells them how much air you can suck in, and the vital capacity that tells them how much air you can blow out, or how much total volume are you holding in your lungs. This is just going over again with the drugs. Don't ever hesitate to ask, what are they giving you? Whether it's a pill, whether it's an injection, whether it's an IV solution, always make sure you check to see what they're giving you and whether or not that medication is contraindicated.